Welcome to another episode of Med Madness, where we delve into critical topics that are essential for medical students and professionals alike. Today, we're focusing on postpartum uterine atony, a condition that is crucial to understand due to its significant impact on maternal health. This episode will cover the definition of uterine atony, its causes and risk factors, symptoms, diagnosis, management, and treatment options. We'll also discuss a real-life case study to illustrate the concepts and emphasize the importance of prompt and effective management. Next, let's discuss what this condition is. Postpartum uterine atony refers to the failure of the uterus to contract adequately after childbirth, leading to severe bleeding. It's the most common cause of postpartum hemorrhage, occurring within the first 24 hours post-delivery. Several factors contribute to uterine atony, including uterine fatigue from prolonged induced or precipitous labour, intra-amniotic infection, and uterine overdistension, which can result from multiple gestations, macrosomia, or polyhydramnios. Additionally, retained placental fragments and grand multiparity, defined as having 5 or more previous deliveries, are significant risk factors. The pathophysiology involves insufficient uterine contractility, which prevents the uterus from clamping down on the blood vessels at the placental site, leading to continuous bleeding. Now, let's move on to the symptoms and clinical presentation. Patients with postpartum uterine atony typically present with heavy vaginal bleeding, often with blood clots. Clinically, the uterus is found to be enlarged, soft, and boggy, and the uterine fundus is palpable above the umbilicus due to decreased uterine tone. This condition can sometimes go unrecognized initially, as blood can accumulate gradually in the lower uterine segment, leading to delayed hemorrhage detection, as observed in some patients. Next, let's explore how this condition is diagnosed. The diagnosis of uterine atony is primarily clinical. The key diagnostic feature is the presence of a soft, boggy, and enlarged uterus in the setting of significant postpartum bleeding. Ultrasound may be utilized to rule out retained placental fragments, typically indicated by a thin endometrial stripe suggesting an empty uterine cavity. However, the immediate and critical nature of the condition often necessitates rapid clinical assessment and intervention rather than reliance on imaging alone. Now let's discuss the management and treatment options available for this condition. Management of postpartum uterine atony involves a stepwise approach. Initial steps include bimanual uterine massage and correction of bladder distension to improve uterine tone. High-dose oxytocin is administered as the first-line uterotonic agent. If bleeding persists, tranexamic acid, an antifibrinolytic agent, is introduced to prevent the breakdown of blood clots and achieve hemostasis. Second-line uterotonics such as carboprost, trimethamine, and methylagonovine are used if necessary, though carboprost is contraindicated in patients with asthma and methylagonovine in those with hypertension. Mechanical interventions like intrauterine balloon tamponade may be employed for continued bleeding. In cases where medical and minimally invasive techniques fail, surgical options such as uterine artery embolization or hysterectomy may be required. Next, we'll look at a real-life case study to illustrate these concepts. Consider a patient who presents with heavy vaginal bleeding and an enlarged boggy uterus 1 hour after a forceps-assisted delivery of a macrosomic infant. Despite initial management with bimanual uterine massage and high-dose oxytocin, the bleeding persists. Tranexamic acid is administered, followed by carboprost tromethamine, considering the patient's history of hypertension. An intrauterine balloon tamponade is placed, successfully controlling the hemorrhage. This case highlights the importance of a methodical, stepwise approach to managing postpartum uterine atony and the necessity for prompt intervention to prevent severe complications. Finally, let's summarize our discussion. In summary, postpartum uterine atony is a leading cause of postpartum hemorrhage that demands immediate recognition and treatment to ensure maternal safety. Understanding the risk factors, clinical presentation, and management strategies is vital for all healthcare professionals involved in obstetric care. Early diagnosis and prompt, effective treatment can significantly reduce morbidity and mortality associated with this condition. Don't forget to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your learning and ensure a thorough understanding of this critical topic. Thank you for tuning in to Med Madness. Until next time, stay informed and stay prepared.